Can you hear me? Thanks for joining us.
I can hear you loud and clear, Tim. Thank you so much.
Great. Well, I want to start out and just start talking about the big picture. Where do you think, and I've been, obviously, we all follow what the governor goes over and what Nate Smith at the Department of Health, they're doing a great job. We follow the data. But what are you seeing as a practicing physician? And just a little background, Dr. Bledsoe is an emergency room physician by training and by craft. And so what are you seeing as Surgeon General and as a practicing physician?
Well, that's a great question, Tim. What we're seeing right now is we're seeing across the state not an overwhelming number, but certainly a significant number of COVID-19 patients. My colleagues and I who work in the emergency department, we're seeing a few in every department, it seems like. And that's not overwhelming, obviously, to our emergency departments at this point. But it is something that takes up a lot of time and effort when you have one of these patients, because before you enter the room, you have to make sure that you have your PPE in place. If the patient is sick, if the patient is significantly ill, then it takes a lot of time to do that work to make sure that they get the care they need and that the medical professionals are protected. But you know what I'm hearing across the board from colleagues of mine, nurses who are working in our hospitals, is that they're concerned about what's going on, but we're not yet overwhelmed. And it looks like the social distancing is having a positive effect, and we're keeping that curve flat. And we have the bed capacity and the ICU capacity and the hospital space that we need to take care of the people of Arkansas.
Thank you for that. We've got a little bit of a delay, so we're going to work with that. But I think that we're able to hear you properly there. So I want to follow up, and I'll ask a little bit of a longer question so we don't have as much back and forth. If you could talk a little bit about the situation with PPE, with respirators, and then thirdly, how dealing with the coronavirus and COVID-19 is impacting our health system's ability to deal with what we would normally be dealing with: heart disease, cancer, emergencies, what have you. So PPE, respirators, and impact on dealing with other illnesses. If you could address those, that would be great.
Sure. No, those are great questions. So regarding the PPE situation in Arkansas, just like many other states, was a serious concern at the very beginning. Those of us who work in healthcare and those of us who are in the public health sector identified this very early on as a big problem, as did many other healthcare professionals around the state. So at the very beginning of all this, I had a significant number of people who were reaching out to me. They were asking me about PPE. The governor identified this very early as a problem and allocated $30 million to purchase PPE in addition to the federal amount that we were allocated. And then when it seemed like we were being outbid by other states, he allocated another $45 million so that we could make sure we get the PPE that we need. But even then, it was slow. So we started crowdsourcing, trying to get PPE from whatever source we could. I actually reached out on social media and on Twitter trying to find people who would be willing to sell us PPE. And we were able to get some small batches of that. But you know, just like every other state and every other healthcare system, for a while it was really a serious thing. Thankfully, last Sunday on Easter, we got our first big shipment of PPE from the first 30 million that the governor allocated. We got 6 FedEx trucks filled with it, and that has been distributed around the state and will continue to be distributed. We've got some other shipments that are coming in. And so in talking to my peers across the state, it does appear that the PPE situation is definitely much improved. And in some places, they actually have some PPE on hand and in storage now, which is what they need. There are some other clinics, and especially in the rural areas, that are still needing PPE, and we're in the process of getting them what they need. So it's by no means a solved problem, but we've made big strides on it over the last few weeks. But it could have been an even worse problem. So that's an overview of the PPE situation. It's an ongoing struggle, but we've made a lot of progress. The second thing that you asked about is a great question. Right now, in the state of Arkansas, we've been averaging under 30 people on ventilators each day, and that's a great data point for us to follow as people of the state. And the reason that that's a great data point is that the big risk that we have regarding ventilators is that we'll overwhelm the system. We'll run out of ventilators, and the people who need the ventilators won't be able to get the ventilators that they need. And that's what's happened in other places, like in Italy. And in New York, they had a very critical time when they didn't have the ventilators that they needed. And certainly, we want to be able to give the maximum amount of support to any patient that comes into our hospitals in Arkansas. So making sure that we have ventilators on hand for critical patients was an imperative. It looks like we do have the ability now and a significant reserve of ventilators. I've been told that we have I don't know the exact number, but somewhere around 800 ventilators, depending on how you count it, across the state. And we only have 26 of those people, or around 26 to 30 people on ventilators right now from the COVID-19 virus. So that's a good thing. We seem to have a significant reserve of that. And so if people do get critically ill, we should have the ventilators that we need. But your last point is an excellent point as well. And that's, what's happening in our public health system while this is going on in a situation where we're social distancing and we're trying to refrain from elective surgeries to open up capacity in our hospitals in case we do have a surge of COVID-19 patients, and what's happening to our public health otherwise. What a lot of people don't realize, or maybe it's easy to think about once you start thinking about it, but the other illnesses that people struggle with, heart attacks, strokes, uncontrolled diabetes, just other types of illnesses or traumas. Those things are still going on even in the COVID-19 environment. And so we have to have the ability to take care of those things even while we're dealing with the COVID-19 patients. And what we're seeing right now is that we're seeing that people are heeding the warnings, they're social distancing, but I'm getting concerned that maybe we have patients that aren't going to the hospitals for real complaints, things like chest pain and things like stroke symptoms. And they need to be. They don't need to be afraid of going to the hospitals because otherwise they're going to have bad outcomes from some of those issues. And the other thing is that there's a financial ramification for not doing the elective surgeries in our hospitals. And I'm concerned about that as well, because we need our hospitals, and we need especially our rural hospitals and our outlying hospitals to serve the people in our rural communities. And so there is a significant financial impact to not doing elective surgeries. And I think the governor and others are looking at this very carefully, because if we don't start seeing a significant spike in our COVID-19 cases, I think we're going to start looking for ways of opening up our hospital services again, so that the hospitals can begin serving the people in their area, so people can get the health care that they need in a timely manner. And then also we can start generating revenue in our hospitals so we don't lose these hospitals for the long term. So that's a bird's eye view of those three issues that you brought up, and all very good questions and very good points.
Great. Thank you for that. I want to ask you something about something practical. So here at the Capitol, we just finished or we are in the almost finished with the fiscal session, and the first time we were here for a special session, no one really wore masks, and then the guidance changed. I guess a couple of weeks ago. And everybody now wears masks. And the CDC in the early phase of the coronavirus response they were saying, well, masks are really not to protect the wearer. They're to protect others. And we heard a lot about that. But it seems common sense would tell you that, yeah, you're protecting others because you're stopping droplets, saliva, or whatever coming out of your mouth. Yes, that's true. You're protecting others from you by wearing a mask. But it's also slowing or stopping or prohibiting certain things from getting into your system, it seems. It just seems like common sense that having something over your nose and mouth not only protects others, but also protects yourself. You know, I said to my wife the other day, if these masks only help protect others, then why do people wear them when they're painting? Are they trying to protect the paint can? I mean, you know, at some point, it's just common sense, the whole mask thing. And it took us so long to get there as a country when other countries have been doing this for a while. As a physician, can you shine a little light on what the deal is with the mask? I have a mask here. I wore it today into the Capitol. I wore it in the Senate, and I'm not anywhere near anybody now. I'm probably 12 feet away, 13 feet away. But I will wear that mask. Could you talk a little bit about this? There's been a lot of confusing advice on that at the federal level, and I think we've sort of worked that out now. But can you help explain why it took so long to get to this point?
Well, that's a great question. I've been asked that question numerous times by family and friends and other people who are concerned citizens. And yeah, there's a lot of confusion around it. And one of the reasons that there's confusion is part of it's a nomenclature issue. And what I mean by that is, what do you mean by a mask? And so for some people, that means a cloth mask. For others, it means one of the surgical masks that you see a surgeon wearing in an operating room. And others, that means the N95 mask. And for others, that means, you know, the full respiratory thing that it looks like a gas mask or something. So defining what a mask is helps solve that problem or the answers to their questions. So I would say, you know, a cloth mask and a surgical mask, the predominant reasons that we wear those are to protect other people. It could help protect you some, but it depends on the size of the particle you're trying to be protected from. So, for instance, if you're worried about you know, a larger bacteria or something significant splashing up on you, a surgical mask or a cloth mask will protect you or help protect you. But when you're talking about a virus, it could confer some protection, but not a lot. And that's the other issue that's confusing about this is what do people mean by protection? Do you mean zero exposure, or do you just mean improved protection from just not wearing anything? So I agree with your point in the sense that a lot of people say there's no use for these masks, and I don't believe that. I believe that, you know, you do have some measure of protection from even the cloth mask or the surgical mask. But when you're talking about someone that has a significant viral illness and you're trying to protect yourself from them, you really start having to get up into the N95 mask because the viral particles are so low, especially if you're in close contact with that person, that you have to have an N95 mask at the minimum to protect you from that. And when I'm dealing with a patient who's particularly very ill from a viral infection or some other very, very virulent respiratory disease, we even go a step further in the hospital to something called a positive airway mask or a PAPR, which looks like a spacesuit where you have the hood and you have positive airflow that actually pushes out the air. And so you're not breathing in the same air as the patient. That's the full step, the final measure, and that confers not 100%, but pretty close to 100% protection from a patient that has a significant viral infection. But with regards to in general, what's been happening is that people have been giving all sorts of advice. It's been all over the map. They've been contradicting each other. They've been saying, don't wear masks, do wear masks in all these situations. And it's been very confusing. And I think there's a lot of discussion needs to be had about what the WHO did initially, and what some of the organizations, the sort of information they pushed out initially. That's very much open for discussion. But in general, what I think people should understand is that a cloth mask made of just fabric or a surgical mask might protect you a little bit, but predominantly you're protecting your other people from you. And there's not a lot of protection from viruses, especially in close contact with someone that has a significant disease. But if you have an N95 mask, that does give you a measure of protection. And certainly, I wouldn't recommend, interacting with someone with significant disease, even with an N95 mask, because it's not 100%. But also, there's the worry of contaminating yourself just in taking on and off the mask after you've come in contact with people that had significant disease. So there's a lot to that question. There's been a lot of confusion. And when you're dealing with sick patients in a hospital, you're dealing with them in isolation with significant barriers, not only the PAPR, but also, the gowns, gloves, and you're trained in how to take your gown and your glove off in a certain way so that you don't contaminate yourself. And even then, we've seen a significant number of healthcare workers, not only in Arkansas, but in other states who have gotten themselves infected just by using poor technique and taking on and off their gear. So there's a lot to that question. There's been a lot of confusion about it. I hope that answered some of it, but I think it's a great question to ask and discuss.
No, that's extremely helpful. I just want to clarify a couple things. So PPE that we were talking about early, personal protective equipment. Also, you mentioned the WHO, and I will editorialize a little bit here. I think there needs to be significant energy put into investigating China's role here, what they knew, when they knew it, and all of that. And I know there's a lot of discussion about that nationally. That is absolutely important. China has a lot to answer for on a lot of fronts, whether it be human rights abuses or whatever, but this is an additional thing that China needs to be held accountable for. I've got several questions here. What I'd like to do, I'm getting these off of Facebook. So, Doctor, what I'd like to do is read several of these, and then you can answer them. This way we don't have as much delay back and forth. I'd like to give you these if you can answer these. So the first one is, sure. We have Alma on Facebook. She wants to know what the status is of our testing. That's number one. Alma is asking about the status of our testing. Do we have enough or not enough or what have you? Linda's got a really good question. Her daughter works in housekeeping at a hospital, and she wants to know why she doesn't qualify for a COVID-19 raise like nurses. And if you could talk about some of the policy there, if you have anything to add on that. The third one, Ken on Facebook, he says people continue to compare COVID-19 to the flu. Can you, as a physician, comment on that? Is that a dangerous narrative to push? And then, well, I've got a couple more that just popped up. I'm going to go ahead and one of them's related to the other. So the next one, David asked, has President Trump asked you about the success that Arkansas has had? I know that President Trump has spoken with Governor Hutchinson, but if you want to answer that, I don't think you've spoken with President Trump, but maybe you have. And then Betty asked, why weren't EMTs included in the pay bonuses? That goes back to the other question. So the first one was Alma. So that looks like we've got 5 questions there from Facebook. If you want to address those in sequence, that'd be great.
Sure, I'd be happy to. Those are great questions. So question number one from Alma regarding the testing status. Well, it's no secret that the testing for COVID-19 has been a real problem over the last couple of months. And that's for a variety of reasons. But when you look across the state of Arkansas, we're way ahead of where we were, and we're way ahead of a lot of states now, even today. In the beginning, the health department was doing the testing, and they only had the ability to do about 20 tests a day, which is way, way too few, obviously. And so what we did was we allowed physicians to run the test on anyone who they felt like needed the test. But they were very happy to do those tests, but they soon became overwhelmed because of the high quantity of tests that were being sent to them. And so we were having delays of 5 or 6 days. Well, over the course of the last, 6 weeks, 4 to 6 weeks, we've gotten some of this streamlined. UAMS has made some major purchases to increase their ability to test for COVID-19. The health department has made some significant purchases. Over the state, around the state, there have been a number of commercial entities that have entered and been offering testing. So now we can test a lot of people and get most of the tests back within 48 hours. We still don't have the ability to test everyone. And what I tell people is, look, we've got 3 million people in the state of Arkansas. If everyone decides they need a COVID-19 test today, it's going to overwhelm our system. Absolutely. But we're way ahead of where we were just a few weeks ago. So summary of testing is that we're not where we need to be 100%, but we're way ahead of where we were, and we're making progress, and we're continuing to move in the right direction on that. The second question from Linda regarding housekeeping being qualified for the COVID-19 bonuses and raise. For those who are watching who might not know the background of this, what happened very early in the process was the Arkansas Department of Human Services, with Governor Hutchinson's instruction, requested a waiver from Medicaid to allow some of the Medicaid money to be paid to clinical staff, particularly in long-term care facilities who are taking care of COVID-19 patients, to offer them bonuses to not only retain their services, but to encourage them to provide care for these very sick and potentially infectious COVID-19 patients in our nursing homes. That waiver, thankfully, was granted this week. And I have to just say a shout out of thanks to Secretary Gillespie, who's the head of the DHS in Arkansas, and to Governor Hutchinson for being aggressive in pursuing that very early on, because we were granted the waiver. That waiver covers paying bonuses to nurses, to clinical staff, so nurses and respiratory therapists who are working in the long-term care facilities in our state. What that doesn't cover is the non-clinical support staff in our long-term care facilities, and also those who are working in our hospitals. So recently, the federal government, Congress, passed the CARES Act, which was a significant amount of money given to the states to help provide support for the COVID-19 crisis. And Arkansas has been allocated $1.25 billion as part of the CARES Act. Governor Hutchinson has set up a steering committee for the allocation of that money. And what he said in a press conference yesterday was he wanted the first recipients of that, the first decision that steering committee needs to make, is extending that bonus to clinical staff taking care of COVID-19 patients in hospitals. So that's nurses, respiratory therapists, those people. And then also the non-clinical support staff. So housekeepers, janitorial service folks, cafeteria workers, I think would also be qualified, but people providing support roles for those who are doing the clinical care in our hospitals and also in our long-term care facilities. So the clinical staff in the long-term care facilities are being covered under the Medicaid waiver. And then yesterday, I'm the vice chair of the steering committee. Our steering committee voted unanimously to provide that same bonus to the clinical staff in the hospitals and also the non-clinical staff like housekeepers within hospitals and the long-term care facilities. So Linda, if your daughter is a housekeeper in a hospital in Arkansas, she should be receiving that bonus. And that's a directly paid bonus to her. It should not get hung up in the bureaucracy of the hospital. And we're working on getting that money flowing to those deserving folks as soon as possible. And The other question that's come up very quickly is paramedics and EMTs. That's something that I feel very strongly about. I'm an emergency physician. I work with our dedicated paramedics and EMTs on a daily basis. There's no more deserving group of people than our paramedics and EMTs who are out there going into people's homes, picking people up, in a variety of settings around this state and exposing themselves to the COVID-19 virus. They deserve that money, in my opinion. We're going to be looking at that on the steering committee, and I'm going to be pushing with others to get them that bonus. And that hasn't been allocated yet, but it should be allocated very soon. And we're going to be talking about that in the next couple of weeks with the steering committee. So my hope is that paramedics and EMTs will very quickly be included in that. The remaining two questions that we have, Ken talking about the flu versus COVID-19 narrative. There has been a lot of discussion. What I'm seeing right now from the data, a lot of this has been because we've had incomplete data. But what I'm seeing in the data now is that the flu, we know, has a fatality rate of about 0.1% across the general population. We think that the COVID-19 virus has a fatality rate of around 1%, so about 10 times higher. So it's a significantly worse disease. But the COVID-19 is disproportionately severe in people who are over the age of 65. So the flu mainly targets that population as well. But we do think that the COVID-19 virus is significantly worse than the flu, even based on the incomplete data that we have now. The other thing about COVID-19 that makes it unique and different than the flu is that we have some immunity from the flu virus already out in our population. We didn't have any immunity out there when this all hit. And so the danger is not just that people get infected, it's that they get all infected at the same time. And that's what causes the crashing of the healthcare system and the overwhelming of emergency departments in our hospitals. And then lastly, David had the question about, have I talked to President Trump? Lieutenant Governor Griffin is absolutely right. I have not had a conversation with the president this week, but I know that the governor has, and he's been talking to President Trump and Vice President Pence with quite a lot of frequency during all this. And what I'll say is that, those of us who've been dealing with this healthcare crisis, I feel very strongly, and the governor feels very strongly, and I know, Tim, you feel very strongly about this, that this is not just a public health crisis. This is a public health and economic crisis. And we can't just focus on the public health crisis and ignore the economic ramifications, because the economics of this, if we allow our economic problem to grow, it's going to eventually impede our ability to take care of patients and to deal with the public health crisis. And so what we're all looking at right now, and what it looks like President Trump is looking at, is how do we open up our economy in a science-based, data-driven way that still protects people, but allows America and Arkansas to get back to work so that we can start growing again our economy, so that we will have the financial means to take care of patients when they need it. And so that's what we're dealing with. Dr. Fauci, who is one of the world's leading experts in infectious disease and is leading the COVID-19 response on the federal level, has looked at what we're doing in Arkansas and applauded it and said it's a great model for other states. And what we're trying to do now is look for ways of still continuing to protect our population while we get our economy going again and moving in the right direction for everyone who's here in our state.
Well, thank you, Doctor. Those are very helpful answers to a lot of the questions we're getting on Facebook. And I just want to say we are getting a ton of questions on Facebook. So we try to keep these to 30 minutes. We're doing these every week at 6 o'clock on Thursday at 6 o'clock. Sometimes we go over a little bit, so I'll go over a little bit tonight. I want to just say, if you do not get your question answered, please call here, my office, 501-682-2144, 501-682-2144, and just give us a call tomorrow. I'm going to run through a couple of these. So I know that Christy asked about the timeline of when we might be able to reopen. I think you discuss that. I would also add there's not a definite timeline. Obviously, that's got to be guided by the science, but absolutely, I agree, and I've been emphasizing that this is a health crisis, but it's also an economic crisis that has negatively impacted families and businesses. Some businesses have merely been disrupted, but other businesses have been absolutely devastated by this. And so I think, Christy, I would just say stay tuned. A great place to get information, I'm sure you're doing this, is watching the governor's press conferences when you can. Those are usually at 1:30, and 1:30 every day, and even on the weekends. And he talks a lot about the reopening and what he's thinking about there. Let's see. So, Doctor, well, before I go back to you with these final questions, I want to say to Caleb in Maumelle, I know Caleb, and happy to talk with you about the specifics of your question. He was just wondering what the cities and counties can expect to receive in funds from the $1.25 billion that you were discussing, Doctor. If you can address that, what are cities and counties, what can they expect to receive? And Caleb, you can always call me and we could get in more detail about cities and counties, but I'll let Dr. Bledsoe mention that. Let me see what else we've got here. That's one. Number two, Christy asks, with many hospitals having to furlough employees, when will they be able to perform elective surgeries again? A lot of hospitals are furloughing employees because they cannot, under the directive, conduct elective surgeries. When will they be able to do that again? Another question, a third question, Brandy asked, is it true that COVID-19 can give you stomach flu symptoms like stomach cramps, nausea, vomiting, etc.? And Tiffany on Facebook says that she lives in Arkansas but works in Tennessee as a healthcare worker. Will she qualify for the bonus even though she works out of state but lives here? So we'll cut it off after those questions, and we'll let you answer those, Doctor, and then we'll come back to me to close things out.
Sure. Well, those are great questions, and I'm happy to answer those as best I can. So starting with Caleb, there's a steering committee that's been set up. It's made of about a dozen people, including, I think, 4 or 6 elected officials, and then a number of individuals from Governor Hutchinson's cabinet. Elizabeth Smith, who is the Inspector General for Medicaid, is the chairwoman, and I'm the vice chair of that committee. We're still in the process of developing the means and the structure by which we evaluate all the different needs that are out there. 1.25 billion seems like just an absolutely unbelievable amount of money. But when you're dealing with hospitals that have lost millions and millions of dollars, and the health, and also all the businesses that have been devastated, it actually needs to be very judiciously applied, or we won't get it to all the people who need it. We're trying to develop a fair process to hear the various requests. When that's developed, that'll be publicly released. These are public meetings. And so I'm sure Lieutenant Governor Tim can get you more information on that, or you can follow the governor's press conferences or just look online, and we'll be pushing that out publicly. I can't answer the question as far as how much will be allocated to each city or county. It's going to be needs based, but that is something that we'll be looking at. Christy, it's a great question. I heard 2 questions there. One was that things up, and especially with regards to the elective surgeries. So if you follow the governor's press conferences, one of the things that he said today was that he's in a measured way and in a safe way to begin doing some elective procedures. The governor has established a medical advisory board that consists of and public health officials from around the state. And we're going to be looking at a lot of different protocols and ways for opening up the state in a systematic way, driven by data, guided by the public health numbers and the COVID-19 infection numbers that we have, but trying to open it up in a safe way for the people of Arkansas. At the very top of that list, the Medical Advisory Board is looking at elective surgeries. We have a phone call scheduled tomorrow morning with Governor Hutchinson to talk about some of our recommendations, and that's going to be at the top of the list. So I would say that of all the things that we're looking at to potentially begin opening up the state, as long as we have the hospital beds and as long as our COVID-19 numbers aren't increasing too rapidly, the elective surgeries at the hospitals would be the first thing at the top of the list, assuming that we don't have a new spike of numbers and assuming we have PPE and the supply lines available to get more PPE once we begin doing these procedures. So I would say stay tuned. We're going to be evaluating that in the next few days. Hopefully it won't be too much longer, but that's at the very top of the list. Brandy asked a question about the stomach flu. And yes, COVID-19 has been shown to have, to cause predominantly respiratory symptoms, but also some GI symptoms. There also is some concern that it's actually spread through GI transmission. And so that's concerning. And that's one of the reasons why we pushed to have janitorial services and those who are working in hospitals as support staff to also receive these bonuses, because I believe we're getting significantly exposed to these infections when they're cleaning restrooms and when they're dealing with bed sheets and things of that nature. So yes, stomach flu symptoms, GI symptoms are something that we are seeing, not as much as respiratory symptoms, but we are seeing that with COVID-19 patients. And then last, the question from Tiffany, who lives in Arkansas but works out of state. I can't say 100% for sure, but my suspicion, Tiffany, is that unfortunately you would not qualify for the bonus, because the bonus is going to be tied to providing healthcare in the state of Arkansas. It's being paid through the organization from this allocation of money, not directly into bank accounts, but through the organizations that employ you. And what they do is they calculate the number of, you get an increase, a bonus based on the hours that you work. And so they calculate the number of hours and they base your bonus off of that. So it does go through directly to the employee. There's no percentage of it that is withheld by the employer other than taxes. So there's no administrative fees that get paid to the hospital or the employer organization, but it is being allocated through the employer to make sure that we get that money to the people who are working on the patients here in the state of Arkansas. So most likely, unfortunately, you wouldn't be able to participate in the bonus here in Arkansas. I think that's covered all the questions that you sent over, but these were great questions. I really appreciate everyone participating in this. Certainly this is an unusual time, but I appreciate, Tim, your leadership in pulling this all together, and of course, all the work that you do around the state and helping the people of Arkansas and supporting our healthcare workers. So thank you very much for the opportunity to participate in this live discussion.
Well, thank you, Doctor. This has been incredibly helpful. We've had a lot of engagement online, and hopefully people are able to use that information that they got tonight in a way that can help their family, or maybe keep them safer, keep their loved ones safe. I wanted to give you a few websites that can be really helpful. One of them is the Arkansas Department of Health website. It's healthy.arkansas.gov. And I know, Doctor, you work a lot with Dr. Nate Smith over at the Health Department. They've got a lot of resources on that website, healthy.arkansas.gov. For economic related matters, some of the programs, initiatives that are there to help businesses, you can go to arkansasedc.com. That's the Economic Development Commission website, arkansasedc.com. And of course, I have a lot of different resources that are compiled on my website, and that is ltgovernor.arkansas.gov. You can go to any of those, and of course, you can call my office, 501-682-2144. I hope everybody is signed up for emails. You can sign up on my website so that you know about these weekly webcasts. We'll be having another one next Thursday at 6. Thank you for joining us tonight. Doctor, thank you so much for joining us and giving us your time. And thank you for all you're doing. We know that you and all the healthcare workers on the front lines are really risking their lives to keep us safe and healthy. And we just want to say thank you to you and all the others that are helping out at our hospitals and healthcare facilities. So thank you for joining us, and hope to have you join us next week. God bless you and stay safe.
Thanks, Tim.